Welcome to Living Life to its Fullest, where we share information about how the profession of occupational therapy can help our community and beyond. I'm Amy Mayer, owner of Mayer Wellness and Myofascial Release, and this is Janel Meis, my co-host, founder of the Toy Box. In today's episode, we're going to talk about the profession of occupational therapy. What is it? Who are we? What we do? Where we work? And a whole lot of other information. But before we get there, first let's do some introductions and learn about your co-host. So Janelle, tell us a little bit about yourself and your role in occupational therapy.
Yes, so I have been an occupational therapist for 7 years. I've kind of dabbled in all of the practice settings we can work in, but pediatrics is my favorite, it's where my heart is. So I've been primarily focused in pediatrics, working with children all day, every day. I have a passion for treating kids with sensory processing disorders and also providing aquatic therapy intervention.
Why did you decide on OT as a career?
Okay, so actually it's kind of a crazy story. But I did a mission trip in high school and through my church, and we went to St. Louis and we worked in the Center for Head Injury Services. And so I was working with individuals who had TBIs, and unbeknownst to myself, I had no idea what I was doing. We also cleaned out closets, but primarily just engaged and interacted with them, and that was between my sophomore and junior summer. And then our junior year, we have to do a career project, and I just kept reflecting back to that experience and how impactful it was and how, I really wanted to help people like that. And my mom's like, well, maybe you should look into occupational therapy. And I had a very linear, I'd only seen what OTs do with individuals with brain injuries, so I had no idea really the vast practice settings that we can work in. So from there I just continued to dabble in it and decided I'm going to do this for my life, and I was one of those that went to college, did exactly what I was going to do, and here I am.
Okay, so what I want to know about that is, how did your mom know about occupational therapy?
I've actually never asked her. I should do that. Can we phone a friend? Hello, Mom. How did you know about OT? One of our good friends was an OT, and they were in the card club, so maybe that's how my mom knew about it, but I've never actually asked her. I should do that.
Okay.
Yeah.
And you founded the Toy Box.
Yes.
What is the Toy Box?
Yes. So the Toy Box is my niche within the OT profession, and I founded it primarily to help parents understand the value of play in childhood development. So as a practicing pediatric OT, I kept seeing children later in life that I thought maybe, if I could have seen them in the earlier years, would they have needed me further down the road? And I'm like, well, if I could just get it into this play environment and allow parents to engage with their children in a more therapeutic, beneficial way, not just, hand them a toy and then be done, or allow them to explore it. So really for me, the Toy Box was founded in this mindset of preventative medicine. So I want to help parents understand the value of play in childhood development, and the Toy Box was founded for that benefit. So
there's a lot more to know about the Toy Box, but
yes.
We'll get there. I have purchased 2 toy boxes for my 2 grandchildren, and they love everything in there, and there's great ideas that help you know how to play with your child to stimulate certain types of skills.
Yes.
As you play, or they play with the toys, or you play with them. So it's pretty cool. Pretty cool.
Thank you. Yeah.
more to come on the Toy Box on another show.
Yes. So let's hear about your background.
Yes, I am sort of the opposite of Janelle in many ways, but we're the same in many ways too. So I've been around in the profession of occupational therapy for about 27 years, and I primarily have worked with adults in my career. I started my career in inpatient rehab, working with people with spinal cord, brain injuries, stroke, multi-trauma, and moved on from there. My second job was working in a private practice where I helped develop the occupational therapy department, and we had contracts in every kind of setting you could imagine, from a little bit of school systems, but I hired somebody else to do that. And then skilled nursing, mental health, inpatient and outpatient, every setting you can really imagine. And then that was in Northeast Iowa, then moved to Omaha and worked in an acute inpatient hospital, trauma hospital, managed there for several years, and then moved into academia for several years. And then now I'm living my dream and own a private practice, working primarily with people with chronic pain, using myofascial release, focusing on body alignment and ergonomics.
How did you develop your passion for your private practice now?
Yes. When I was a new graduate in the inpatient rehab, we had a doctor that really was forward thinking in terms of how to deal with pain and just didn't want to give our patients more pain medicine. And he would find other ways that we could help them, manual techniques and such. And he found myofascial release, the Barnes type specifically. And he sent one of our senior therapists to learn, and she got super busy and wanted somebody to help her. And I was the new grad who wanted to learn anything and everything, and so she taught me. So myofascial release has been part of my career all the way through, and has been sort of a side gig. My career has taken me on many twists and turns, but back here doing it now. And it pairs extremely well with who we are as OTs. The ergonomics, looking at how people move throughout their day, throughout their occupations, through their daily tasks, and how all that feeds into what they're experiencing or how they're experiencing pain in their bodies. So I wasn't sure where my path of OT would go, but that's one of the cool things about occupational therapy is we have some core philosophies, but we can do so many different things with so many different kinds of people.
That's why I love it too. There's such a beauty in the vast variety that you can do, and you really make it what you want and fulfills your life as well as the people you work with, so it's pretty great.
Yes, and nobody suggested occupational therapy to me when I was looking, so if there's young people out there looking for, if you want to explore a job and explore occupational therapy, I would encourage it, even if you're in the middle of college, which was where I was before I found out about occupational therapy. I was pretty sure I was going to be a clinical psychologist, and I got to abnormal psych and knew that I couldn't do that. I was sort of envisioning myself in a closed room with my client on a couch, and I'm in a chair like this, just trying to figure people out, and I just couldn't imagine sitting all day long. And so I took a test where they say you're good at this or you're not good at this, and occupational therapy was in the top 3, and my counselor had no idea what it was. So she said, I think they work in hospitals, why don't you call the hospital and see if you can go volunteer for a while. And I did, and I fell in love. When I walked in, the occupational therapist was making pancakes with a farmer.
Awesome.
And he had
Occupation.
He had his overalls and his plaid shirt on, and he was the cutest little guy. But he had a stroke, and what I saw as from the outside looking in was I get to be in this brightly lit place, and people are having fun, and they're making pancakes.
Every day.
That sounded awesome to me, but later, as I really understood the profession better and talked to this therapist, I found out that she's only making pancakes because that's something that he likes to do. It's meaningful to him. And they were trying to figure out, can he go home and make pancakes safely at home? Not just pancakes, but can he cook safely at home? And she's looking at his cognition. Can he sequence through this task safely? Does he remember to turn the oven on and off? Does he have enough manipulation or skill to manipulate the tools that he needs in his hands? Can he do all these things safely so that can he go home or not, or is he going to need some help? And that's a huge part of what occupational therapists do, right?
Yeah, amen.
Yeah.
We want you to be as independent as possible. Doesn't matter how old or young you are, which I guess maybe let's jump into kind of defining like who we work with and then occupation of it itself. So we can work with as young as the NICU babies all the way up to those that are 100 plus years old. So we cover the entire lifespan, and our goal is to help improve their independence and function in whatever activities they love to do. So for kids it's play, so I play all day. It's lovely. And just trying to get them to do tasks that they want to do or that their parents want to do. And one of the interesting things within the pediatric population is you have and I would actually probably argue all populations, but you kind of have a family unit that you're working with. It's not just, you're not always just treating the child. You might be billing or working with that particular kid, but the child is impacted by the family unit too, and so you're including the parents within all of these sessions and trying to engage like how they work with their siblings and figure out the best way to really make them as wonderful as they can be.
Mm-hmm. Oh, definitely. The family unit is important in every setting. People rarely live in isolation. So let's go back to the word occupation. Yeah. I think that's what trips up the public. And occupational therapy is one of the fastest growing professions out there. And so if you're looking for a stable career to get into, even as a second career, occupational therapy is growing quickly, partially because our population is aging.
Yes.
And also because there's a lot more going on with kids these days. Mm-hmm. More autism, what other kind of diagnoses are growing out there for...
I feel like sensory processing disorder is also becoming kind of a mainstream diagnosis as well. There's a lot of difficulty with attention and focus, and I mean, you kind of name it, our world needs to be a better place.
Yeah, so the word occupation is what often trips people up in terms of understanding what we do, and both of us have walked into plenty of hospital rooms and been told, oh honey, I don't need a job, I'm retired.
I'm fine.
It's not that kind of occupation, it's what occupies your day. Mm-hmm. Your occupations are the things that you either want to do or need to do to get through your day.
Yes.
And so for occupational therapists, occupation is the core of what we do. We believe that occupations are powerful. They're what give meaning to our lives. Mm-hmm. So there's lots of things out there that we need to do or want to do, and without those things, our life can change dramatically. Yes. So if we have an illness or an injury that stops us from being able to dress ourselves or take care of our kids or our pets, then that changes our life dramatically and takes away a lot of meaning. So occupation is powerful. It's occupation is often the goal too in our profession. Mm-hmm. So as Janel said before, we're really focusing in on function and trying to help people become more functional. So when we're thinking about the goal of our outcome, our short-term, our long-term goals and working with clients, it's to be more functional, to be able to complete occupations that are important to them.
Yeah.
Yeah, so the occupations are often the means of what we do too, or part of the process. Not always, but as Janelle was saying, that kids' occupation is
play all day.
Exactly. So we use occupation as our modality in working with our clients, but it's also the outcome of what we do as well.
Yes. So we really want anything that's purposeful and meaningful to that individual. We want to include it within our sessions and how we work with our clientele. Mm-hmm.
So lots and lots of different settings that we work in. And probably one of the most widely known settings that occupational therapists work in are hospitals. So if someone comes into a hospital, let's say they've had a stroke. When someone's had a stroke, they can be affected, their body is affected. Almost all of us know somebody who's experienced a stroke, or we've seen a person who has had a stroke or seen it in a TV show or a movie. One side of their body may not be functioning properly. But what you may not know too is that they may have some visual disturbances. They might have some thinking disturbances where they can't remember things. They might have some communication disturbances as well.
Yes.
Did I hit everything?
Yes, you did. She's doing great.
Strokes can be really all-encompassing deficits to the body because the problem is in the brain.
Yes, and you can have people functional, like they could get themselves dressed, but then they might not still be able to return to work. And so you can, after you leave a hospital, I'm kind of jumping ahead, but after you leave the hospital, you could still go to outpatient therapy to work on some of your cognitive deficits to improve your functional independence. For example, I had an individual who had a stroke in the hospital and couldn't visually scan anywhere, so we were putting numbers on the walls with the deck of cards, just trying to get his vision. And then we tried, he was previously an accountant, and I tried with him like just doing simple math worksheets, and he couldn't even do them. He couldn't figure out how to like process it and do the simple math subtraction and addition. So although like sometimes they can be completely functional as far as mobility with getting dressed and walking around, you can still have some underlying deficits too that we also work with.
Yeah, so a stroke can affect all those things or one of those things or some combination of all those areas of functioning. And it's our job as the occupational therapist. We work with a team of people, of course, in that setting, but it's our job as the occupational therapist to figure out what underlying skills are missing or have been affected and how those missing skills affect their ability to do the tasks they need to do, to do their occupations. So we have really two major approaches when we're working with a client like that. One is rehabilitation. We're trying to help them get all of those skills back, like Janel was describing. We're going to work on these skills to try and get you back to where you're going. That's trying to use rehabilitation techniques to get back to that. However, a lot of times, things take a lot of time. The stroke recovery takes a lot of time, skill development in kids takes a lot of time, so we're often doing a lot of compensation as well. So even though maybe you have lost some of your memory skills, we're going to teach you other strategies so that you can maybe do things a little bit different, but you can still get through your day. Right. If you still can't use this whole side of your body because rehabilitation takes time, but in the meantime you need to be functional, you need to be able to get dressed, we're going to teach you compensatory strategies to be able to do that.
Yes. And sometimes with compensatory strategies too, you'll use different equipment or items that'll help improve your independence more easily than without them.
Yeah, OTs we're kind of known for our gadgets.
And we create gadgets too.
We create them, there's lots out there, products out there in the world, but if we can give somebody a sock aid to help them put their socks on independently, and that's what they need, and that's important to them, then we're known for that kind of thing a lot too.
We have lots of gadgets.
Yeah, so do you have any stories about kids that you've worked with and how OT has made a difference?
Yes, so I have, well, I mean, there are loads of stories, but the one that always sticks out to me the most is I saw a child who had sensory processing disorder, and to kind of describe that, they can be set off or alerted at certain times without really, unbeknownst to them or their family, really what's the trigger. And so it's a lot of adaptations and behavioral experiences that I kind of work with them and figure out the best treatment intervention kind of. It's rather complicated. But for him, I saw him in the outpatient clinic, and we use a lot of different therapy equipment like swings and tunnels and slides and climbing and all of these things that kids love to do. And we made good progress, and he was just trying to get through the school day without having like an emotional meltdown or outburst and whatnot. And we made good progress in the beginning, and then we kind of became stagnant. So I was like, you know what, I think we should transfer him to the pool. And so we went from land-based therapy to aquatic-based intervention, and I just had this feeling in my gut that he needed the pool-based intervention to really provide him. I mean, the water's exhausting. If you remember from the young days when you're swimming, like kids get out and they're super tired, but there's a constant like pressure of the water on your body that it improves their regulation and proprioceptive system. So for him, we did like a month and a half of pool-based therapy, and then by that time, you know, he would get, I would say, out of the 5 school days, probably 3 of them, he wouldn't have any emotional outbursts or anything like that. And so I kind of attributed it to the aquatic therapy intervention, and you do just a ton of different activities in the water against the resistance, pushing and pulling. And he was older, so I think he was 8, if I remember correctly. And usually the pool is super motivating to 8-year-olds, and they don't think it's this atypical thing that they're going to. It's just kind of like, oh, it's a pool intervention, this is kind of cool. So that was a nice psychosocial component that I appreciated within that too. So that's one example.
So how did you recommend the family move forward then? Did he stay in and come into the aquatic pool consistently, or did you recommend that he go get in some swim class, or what?
So yes, so basically it was just doing like, the family could go to the Y and swim. So it was the carryover after I thought I was done was just to continue on. Like using the pool intervention strategies. But
So swimming became one of his occupations.
yes, yes it did.
Okay.
Yeah.
So, a story that I kind of wanted to tell too that kind of
Yeah.
differentiates some of the other professions from occupational therapy and how we might approach a problem. When I was working in my second job and doing some home-based care, we had a contract with a senior residential independent living community. And we had a gal, an older lady, older woman, who was having falls. And the nurse had gone in and checked on her, checked her blood pressure, and checked all her medical potential risk factors from a medical perspective. She couldn't find any, sent her to the physician. The physician couldn't find any risk factors that would account for these consistent falls, but it was still happening. So she was definitely at risk for being moved into a more restrictive level of care, which she didn't want and the facility didn't want for her either. So they contacted our therapy resources, and the first resource that went in was physical therapy. And they went in and they found out that, yeah, she had some weakness in her upper extremities, her lower extremities, and they really worked hard to bring those up to a more functional level. They checked out her walker, which she was using, to make sure she was using it safely and that her gait was normal, and worked with her on that, and they got everything really up to speed with that, but she continued to fall. And nobody could figure out what was going on, so they called occupational therapy.
Dun, 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 dun.
And it was, I went in and I'm like, I'm not sure what I'm gonna be able to do if she's medically fine, and but let me do my process and see what happens. So I went in and I asked her some questions about her day. Tell me about your day. When are you usually falling? What's happening when you're falling? And she says, well, I think it happens most of the time when I'm getting dressed in the morning. And I thought, okay, all right, well, I'll be back tomorrow morning and I'll go through your routine with you and we'll see what's happening. So we got up, we went into the bathroom, we did a routine in the bathroom, everything seemed perfectly normal. We went into the bedroom and we were going to start getting dressed. We opened up her closet. I had never seen so many outfits crammed into one closet in my entire life. And I'm like, okay, well, let's pick an outfit. And so she walked her walker up to the closet and she was looking around, choosing what to wear. And she started to pull an outfit out, and it was so packed in there, when she started to pull it out, she started to fall backwards. And had I not been there, we would have had another fall.
Yikes.
So what was happening was she was struggling to get things out of her jam-packed closet, and when she would pull it, she would lose her balance and she would fall. So
And was it primarily only during the dressing routine in the morning?
yes.
Wow.
So what we did was we called her family member,
Yes.
family dynamic,
Yes.
and her daughter ended up coming in, and they really thinned out her closet and just had a few things hanging in there, so she didn't have to struggle to get things out. She didn't have to reach or bend, and she could get out safely, and that stopped the falls.
And miracle worker.
So understanding the routine of somebody's day and the occupations that affect their life can be really powerful in figuring out what's going on. And I've had numerous clients where it's figuring out, where is their computer? How is it set up? How is that affecting their neck, their shoulder? How are they sleeping at night and positioning themselves? That's an occupation too.
Yes.
So, let's wrap up.
Yes, we should.
OT
We can go on forever.
Yes. So occupational therapists can be in many, many, many settings, and you will see them working in not just hospital type settings, but out in the community as well. Anything else you want to add?
Really fast for those who might consider it as a second career or even a first career, there's two different degree levels you can get for occupational therapy. So there's becoming a certified occupational therapy assistant, which is a current associate's degree, and then we have a master's or a doctorate in occupational therapy as well. So depending on how much time you'd have to go back to school or what your interest level is and your financial component, there's multiple ways to become an occupational therapist.
All right, well, tune in to future shows where we'll talk more about specific skills that OTs can bring the community.
Yes, thanks. Thank you.